I had a patient that was in his mid-40s and he was suffering significantly with memory loss. It got so bad that he was even dealing with issues with memory recall, where whenever he would get in his car and was be driving somewhere, he couldn't remember where he was even going. And it even got even worse when at work, he would get on his phone or go to his computer and couldn't remember what he was trying to look up in the first place. And he had tried everything. He had tried a lot of different ADHD medications that his doctors have given him because he said it was due to his ADHD. He tried lots of different supplements to help with his memory, but none of it just seemed to work for him. So when he came to me, my biggest concern and thing that I wanted to look at was, what was the root of the problem of this? Why was he suffering so much with having constant memory issues and the ADHD medication wasn't doing anything for him? So I ran several different tests, and one of the biggest things that I found that identified probably the biggest thing out of anything was that his serine levels were significantly low. Now, serine is a very important amino acid that significantly does impact our memory when it is deficient. So right away, I decided to give him phosphatidylserine 150 milligrams twice a day. And within just a few weeks, he told me that his long-term memory improved. He wasn't having issues of forgetting a lot of different things, and this made drastic improvement in his memory. However, he was still reporting to me that he would still have the issues when he would get on his phone or on his computer, forgetting why he would go on the computer, and this still was impacting his work significantly. So I decided to run some other tests to look at, okay, what could possibly be the issue here? And what I found is that his phenylethylamine levels were significantly low, also known as PEA. Now, what is phenylethylamine? Is at the very beginning of the dopamine neurotransmitter pathway. So if that is low, it definitely impacts your memory, it impacts your focus, it impacts motivation. And if this is not addressed, there's a reason why his ADHD medications were not working for him, because ADHD medications do not improve PEA levels. So what does actually improve PEA levels? Well, the thing that does is D-L-phenylalanine, which is an amino acid that directly does help stimulate and increase the levels of PEA. And within just 1 week of taking this, he told me he finally was not dealing with this short-term memory recall, and he was able to always remember whenever he would go on his phone or his computer, and also whenever he would be driving anywhere, he wouldn't forget where he was going. And he didn't have to worry anymore about losing his job. Now for me, back when I was in college, I suffered a lot with memory recall. I had a hard time recalling any information that my professor would teach. It was hard for me to keep up and taking notes, and especially when I would study for exams, I suffered with performing well on exams because I couldn't remember a lot of stuff that I would study. And I had tried different ADHD medications myself. It still wasn't doing it for me. And I tried lots of different supplements, and that also wasn't getting to where it was helping improving my memory recall, and my grades were suffering. I was getting so worried to the point where I thought I might not be able to continue with college because I was just not performing well on the exams. But then I came across these two particular herbs, and these two particular herbs I found out about is they increase blood flow and circulation to the brain, and it's a great antioxidant to protect the brain, but more importantly, it helps with memory and recall. And these two particular herbs were Bacopa monnieri and Ginkgo biloba. Both of these herbs are fantastic for helping with memory and recall. And within just that first week when I was taking it, I was taking a very high dose. I was doing about 525 milligrams of Bacopa monnieri, about 150 milligrams of Ginkgo biloba twice a day. And the biggest thing that I noticed when I was taking this is I could recall everything that my professor was saying. I could take all the notes, and during the exam, I was able to recall a lot of the information and was able to perform better in my exams and was able to stay in college and get good grades. But when I went to medical school, there was definitely a higher demand on my memory recall. And the Ginkgo biloba and Bacopa monnieri was not quite doing what it needed to do. I mean, it was still helping, but I needed to kind of up it up a little bit because I was suffering to try to remember all the information that I had to learn in medical school, which is a lot of information. Was another herb that also increases blood flow and circulation to the brain, but more importantly, helps you retain the information that you're studying and also helps you put it into long-term memory. And the herb that I'm talking about is Rosemary officinalis. Now, I didn't just take it internally. I also used the essential oil of rosemary and put it in a diffuser, and I would have that diffusing and being exposed to that while I was studying. And that's where a lot of the research had come from, is when people would study with Rosemary, is they would be able to put things in more long-term memory and have a better memory recall when they finally went to their exam. And I had the same experience. I'd find when I was suffering before in medical school, I was able to perform a lot better when I started implementing that and have better memory recall. And this was a big game changer for me and also for a lot of patients that I use it for. Now, if you're suffering with memory, focus issues, and low energy, then you should download my free focus and energy all day guide in the description below. Now, I thought my memory was taken care of. I thought it was perfect, but it wasn't quite there. And when it came time for me to study for my final medical boards, I thought I was prepared. I studied more than anybody else, night and day, just studying tirelessly, but I actually failed. And I was absolutely devastated that I was not able to pass my medical boards. All this work and effort that I'd put into suffering with my ADHD and these memory issues, I thought they were resolved. And I didn't know what to do. I felt very unmotivated to want to retest and take the medical boards again because I was just so burnt out. And I decided to seek out some further help because I wasn't sure what was wrong. I thought I had kind of solved it and figured it out, but I had to go seek out other holistic mind doctors to understand truly what was internally going wrong. I found this holistic functional medicine doctor that ran all these different tests. And what they found was definitely something that I was missing. One of the first things that they found was that my omega-3 levels were significantly low. But on top of that, one of the other things that he found significantly that was deficient was my adrenals. My adrenals were completely shot, probably due to studying late at night every night for several days, several weeks and months for studying for the boards and stressing myself out throughout medical school. No wonder I was just burnt out. So he gave me some adrenal desiccated, but on top of that, he saw that there was things I need to improve in my lifestyle, improving my sleep, improving my nutrition intake. He wanted me to increase my protein intake and also my vegetable intake, as well as healthy fats. He said if I just focus more on that and getting good quality sleep and just getting some better rest and implementing these supplements, that I should be able to have better memory recall and perform better on my medical boards. So I had about 3 months to prepare for my medical boards. So I was diligent. I was taking all his advice, taking those 2 supplements that he recommended along with the nutritional and lifestyle changes. And I did notice throughout those 3 months when I would test myself taking prep exams that I was performing really well. I was able to remember, I was more relaxed and be able to recall information that I studied a couple months back. And then exam day came and, I was definitely a little nervous, but I felt more confident and calm because when I was doing all those practice things, I was able to recall things better. But of course, during the exam, outside there was construction going on, super loud and distracting. I was very infuriated about this and they couldn't do anything about it. So I was worried that I was going to fail because I get distracted very easily with my ADHD. Luckily, I was provided some earplugs that I was able to put in, but I found that even with that distraction, I was able to recall information real quick. And that helped significantly when I was able to recall information and not have to stress to think what I was thinking and get distracted by the noise. But the information just came to me quickly. And sure enough, when that letter came, I passed. And I really think it was due to really finally looking at the internal stressors that I had in my body, and especially having that lack of motivation that was hindering for me to move forward. But once I implemented the adrenal desiccated, implemented the omega-3s, I think that made a significant improvement and impact for my memory recall, but also impact on my motivation to moving forward. So if you're suffering with poor memory, you're also probably suffering with lack of motivation. So you should watch this video next. We're talking about the 5 best supplements that actually increase motivation. So watch this video next.